Hello guys, namaste to all. Today I am going to explain you the topic that is blood transfusion. Okay, blood transfusion. Okay, already we know that how why we can transfuse the blood to increase the blood value when it is necessary when RTA cases, more blood loss during surgery, dengue patients, iron deficiency anemia. Okay, in all that thing we transfuse the blood to increase the blood value. That's why we are doing the blood transfusion. Okay, we know that in blood we have RBC, WBC, platelet, plasma. In some time, okay, we do not transfuse the whole blood. Okay, if person is wrong, if we want only RBC, then we transfuse only RBC. If they want WBC, we transfuse WBC. If patient want platelets, we transfuse platelets. If patient wants plasma, then we give the plasma. When okay, like if patients having the hematocrit, okay, HCT value less than 30, we transfuse the RBC. Is a feeling of fatigue. When we check the CBC report, the HCT hematocrit value is less than 13. That time we transfuse the RBC. Okay. What is hematocrit? We know no. If you take the blood in a container or in a oil, and if you take 1 ml, okay, we are taking the 1 ml blood. The RBCs are all the cells are these are the cells, no, RBC, WBC, and platelet. These are all cells are settled down. Okay, most of the thing is RBC only. Okay, why? It's level is more. No, its concentration is more. No, it's just only 1 to 2%. 1% is there. Okay, it is the most of the component, and it is 60%. That is the 40%. In 1 ml, we take in the 1 ml. In 1 ml, the total cells it's about 45 to 50. Okay, like all the cells are down now. The remaining thing is the plasma. When it will come, okay, all the cells are coming down. This level is less than 30. RBC level less than 30. That time we are transfusing the RBC packed cells. Okay. When we transfuse the WBC, if patients having infection, patients have less WBC, that time we transfuse the WBC. If patients have less platelets, okay, what is the normal count of the platelets? 1.5 to 3.5 lakh. This is the normal count of the platelets, and we can transfuse the platelets not less than in the 1.5 lakh. Okay, if it's below 20,000, that time only we transfuse the platelets, and that only the plasma to increase the blood value, sudden increase. Okay, that is called the fresh frozen plasma. We'll talk it later. First thing, a small topic that is the platelet. Then we can discuss about WBC transfusion, plasma transfusion, and RBC transfusion. Okay. First thing I will take platelet. Normal platelet count we know 1.5 to 3.5 lakh. Okay. And we are taking the platelets now. Where we can store the platelet in our room temperature only. We are not in room temperature only. We can store the platelet, that is the normal room temperature is 20 to 24 degrees Celsius. In this temperature only we can store the platelets. And one chemical component also we are using for that, that is one called a preservative. Which preservative we are using means sodium citrate. Okay, this is the thing we can use for storing the platelets. What is the function of the platelets? Can discuss now. The function of the platelets, the clotting, helps in the clotting. Whenever we got injured, the blood flows. No, that time it helps in clotting. I told you one thing. We cannot transfuse the platelet when less than 1.5 lakh. It's about less than 20,000. Okay, in some hospital they will take as a 10,000. Less than 10,000 they will transfuse. Most of the time it's in a dengue. Okay, in dengue patients there is a decrease in the platelets. Okay. Preservative, normal room, in the room temperature only we are storing, and there are the two types of platelets. Okay, one is in platelets there is one RDP and another one is the SDP. We are taking the platelets from the random blood group. Okay, and any blood group we are taking this platelets, that is the RDP, that is about 50 to 70 ml. We can transfuse within 15 to 30 minutes only. Another thing is the single donor platelet. We are taking the platelets from the single blood group. It's about 182 to 40 ml. We can transfuse within 1.5 hour to 2 hours. Okay. That is 6 RDP equal to 1 SDP. Okay. If we transfuse the platelet, when we check in the platelet count now, after 24 hours, there is increase in the platelet count. It's about, in RDP we can about 10,000, 10 to 10,000 platelets can be increased. In SDP it's about 50 to 50,000 platelets can be increased. In between they will increase. Are you understanding my point? Okay. This is all about the platelets. What is called as the when platelet count is decreased in our body, that is what we can call, that is called as the thrombocytopenia. Okay. This is all about the transfusion of the platelet. Normal count, normal room, in this temperature we can storing the chemical agent preservative. We are using two types, RDP, SDP, normal volume, SDP normal volume, transfusion R, and this one is. And in next we can learn about the RBC, WBC, and platelets. Thank you.